Q1. A nurse is caring for 4 clients. Which client should be assessed first? A 76-year-old client with pneumonia who has an oxygen saturation of 91%. B, a 45-year-old client post-appendectomy reporting 6 out of 10 pain. C, a 60-year-old client with COPD who is restless and has an oxygen saturation of 85%. D, a 35-year-old client with nausea and a history of gastritis. Answer: C, a 60-year-old client with COPD who is restless and has an oxygen saturation of 85%. Q2. A charge nurse is assigning clients to an RN and an LPN. Which client is appropriate to assign to the LPN? A, a client receiving a blood transfusion for anemia. B, a client requiring wound care for a stage 2 pressure ulcer. C, a client with a new tracheostomy requiring suctioning. D, a client with chest pain awaiting an ECG answer. B, a client requiring wound care for a stage 2 pressure ulcer. Quarter 3. A nurse is delegating tasks to a certified nursing assistant, CNA. Which task should the nurse assign? A, teaching a client how to self-administer insulin. B, administering a nebulizer treatment. C, measuring and recording a client's intake and output. D, assessing a post-operative client's incision site. Answer: C, measuring and recording a client's intake and output. Quarter 4. A client is receiving intravenous heparin for a deep vein thrombosis. Which finding requires immediate intervention? A, APTT of 55 seconds. B, hematuria. C, mild bruising at the IV site. D, platelet count of 200,000 per millimeter cubed. Answer: B, hematuria. Question 5. A nurse enters a client's room and observes sparks coming from an electrical outlet. What should the nurse do first? A, unplug all electrical equipment. B, remove the client from the room. C, use a fire extinguisher to put out the fire. D, call the maintenance department. Answer: B, remove the client from the room. Q6. Which action by the nurse demonstrates effective delegation? A, assigning a newly licensed nurse to assess a critically ill client. B, asking an LPN to administer an IV push medication. Certifying. Instructing a CNA to take vital signs on a stable client. D, delegating patient teaching to a CNA. Answer: C, instructing a CNA to take vital signs on a stable client. Q7. A nurse is prioritizing care for 4 clients. Which client should be seen first? A, a client who is post-op day 1 after a hip replacement and needs pain medication. A client with a history of hypertension reporting a headache. C, a client with a suspected pulmonary embolism who is experiencing sudden dyspnea. D, a client with diabetes awaiting discharge instructions. Answer: C, a client with a suspected pulmonary embolism who is experiencing sudden dyspnea. Q8. Which task is appropriate for a nurse to delegate to an experienced LPN? A, initial assessment of a new admission. B, teaching a client newly diagnosed with diabetes. C, administering subcutaneous heparin. D, evaluating a client's response to pain medication. Answer: C, administering subcutaneous heparin. Q9. A nurse notices that a client's IV site is red and swollen. What is the priority action? A, apply warm compresses to the site. B, discontinue the IV infusion. Commander, slow the IV infusion rate. D, elevate the affected limb. Answer: B, discontinue the IV infusion. Q10. A nurse is assisting in evacuating patients due to a fire. Which client should be evacuated first? A, a client on mechanical ventilation. B, a client receiving IV antibiotics. C, a client who is ambulatory. D, a client with a fractured femur and traction. Answer: C, a client who is ambulatory. Q11. A nurse is caring for a client with a chest tube. Which finding requires immediate intervention? A, continuous bubbling in the water seal chamber. B, drainage of 50 milliliters per hour. C, dressing dry and intact. D, mild pain at the insertion site. Answer: A, continuous bubbling in the water seal chamber. Q12. Which task is appropriate for a nurse to delegate to a CNA? A, assisting a stable client with ambulation. B, monitoring a client's pain level. C, changing a sterile dressing. D, performing a dressing change on a surgical wound. Answer: A, assisting a stable client with ambulation. Q13. A nurse is reviewing a client's lab results. Which result is most concerning? A. Potassium 5.2 milliequivalents per liter. B. Sodium 135 milliequivalents per liter. C. Hemoglobin 7.8 grams per deciliter. D. White blood cell count 9,000 per cubic millimeter. Answer: C. Hemoglobin 7.8 grams per deciliter. Q14. A nurse observes another nurse failing to wash hands before a dressing change. What is the best action? A. Report the incident to the nurse manager. B. Confront the nurse immediately. C. Remind the nurse to wash hands before proceeding. D. Document the incident in the client's chart. Answer: C. Remind the nurse to wash hands before proceeding. Q15. A nurse receives a handoff report. Which client should be assessed first? A. A client with a urinary catheter reporting mild discomfort. B. A client with a blood glucose of 50 milligrams per deciliter and confusion. C. A client post-op 3 days after abdominal surgery with mild pain. D. A client with a chronic wound requiring dressing change. Answer: B. A client with a blood glucose of 50 milligrams per deciliter and confusion. Q16. A nurse is preparing to administer medications. Which action is the highest priority? A. Verify the client's allergies. B. Educate the client about side effects. Check the client's most recent lab results. D. Document the administration. Answer: A. Verify the client's allergies. Q17. A nurse observes a CNA transferring a client unsafely. What is the best action? A. Report the CNA to the supervisor. B. Stop the transfer and teach proper technique. C. Document the incident. D. Ignore it if no injury occurs. Answer: B. Stop the transfer and teach proper technique. Q18. Which action requires immediate intervention? A. A client on warfarin eating spinach. B. A client with pneumonia having a productive cough. C. A client with a potassium level of 3.5 milliequivalents per liter. D. A client with a new onset rash after receiving an antibiotic. Answer: D. A client with a new onset rash after receiving an antibiotic. Q19. A nurse notices a medication error. What is the first action? A. Notify the provider. B. Monitor the client for adverse effects. Complete an incident report. D. Inform the nurse manager. Answer: B. Monitor the client for adverse effects. Q20. Which client should the nurse see first? A client with COPD with an oxygen saturation of 88%. B. A client with atrial fibrillation reporting palpitations. C. A client with a stage 2 pressure ulcer needing dressing change. D. A client post-op 2 days with stable vital signs. Answer: B. A client with atrial fibrillation reporting palpitations.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.